All right, I'm live for Mental Health Unscripted, where we're going to be discussing random topics of mental health. And we're going to start at 7, which is going to be in like less than 15 seconds. So we're not going to say anything really important until then, because then everyone will be streaming and asking questions. It looks like we already do have some viewers, but I don't see anything online yet. So we're getting started. All right. So here are the general rules of say that, oh, my internet's connection is unstable. That won't be good. Hopefully I'm still online. Hopefully I should be good. Make sure I logged into the right thing. Yep. East of Eden. All right. Yay. Yes. Thank you, Lana, for showing up to our unscripted conversation. So yes, if your name is obviously your name, I will just say your name, right? But if you have some obscure YouTube name, I will not say who you are, just so it's not obvious, in case you wanted to say confidential, reasonably so. There's no promise of confidentiality when it comes to this kind of thing because it's online and people can watch this later. So keep that in mind. But we're here to ask questions. So feel free to ask any questions. We chat about mental health. And yes, it was my birthday on Saturday, so yesterday was my birthday, and I'm in South Carolina now. So I did a Spartan. I actually did 3 Spartans. I did a Spartan Ultra, a Spartan Super, and a Spartan Sprint. The Ultra was about 30 miles, so it's 50K, and then the Super is 10K, which is about 6 miles, and then the sprint is 5K, which is about 3 miles. So 100 obstacles over the weekend and over 40 miles. So it's good. I'm feeling my body's feeling feelings it hasn't felt before. All right, Lana's got a great question. How to deal with anxiety about something you cannot control. That's awesome, by the way. Thank you. And thank you everybody else who wished birthday wishes. Um Yes. How do you? That's a great question. So, and one of the things I want to point out right away with that question is that there is good anxiety. So one way to separate good and bad anxiety is the serenity prayer. To accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. That wisdom is one of the things that we're doing in anxiety. Now, if we have acute anxiety, like an incredible strong anxiety in the moment, the best advice is usually focusing on your body. So focusing on breath work, prayers, uh, looking at the sensation, focusing on your physical response to the anxiety, not what is causing the anxiety. Now, what's hard is a lot of times we are anxious about something that is not acute. It's not cute at all. In fact, it's quite ugly. And what that means is it's something that might happen in 3 months. And we are not mentally very well equipped at being anxious about something that isn't in our control that might be in 3 months. Like that's excruciating for the brain. We are just not designed to handle that kind of anxiety. So the first thing that I would say, if that's the situation, is to give yourself a lot of grace and realize that it's going to be very difficult. And then here is the best secret. And this is like, there's so many specifics, and you can follow up with another question. Anybody, like, we don't have so many people in the chat yet because we're not that viral. But if you focus your imagination on where you want it to go, it cannot be preoccupied with anxiety. So anxiety, fear, depression, all of these are actually products of the imagination. They're images in your head. You're visualizing what should have happened, what could have happened, what you think might happen, what you fear happening, and all of those things. So if you're struggling with anxiety that's long-term off and you know you can't control anything, try to, I think you mean you will be viral soon. But hopefully I am vital now. I think I'm still alive. Um, but anyway, you are going to be you're going to be way better at using your imagination for something that is good. So hopefully that answers the question. Is focus on where you want to go with your life. So like one of the things I wish more clients would practice is the skill of visualization, including, yeah, I'm already vital. Oh, thank you. Yeah, that means a lot. Where Eminem speaks. Um, that's sweet. Yeah, I practice visualization of like what I call my happy place visualization. Maybe that's just because I watched Happy Gilmore when I was a kid. But I think about the woods. I think about a creek. I think about leaves falling in the creek. Actually, some of the run was in that kind of environment, and it was actually very peaceful. And I almost didn't feel excruciating pain when I was in that part of the run because I was able to get in that visualization of just focus on that nature and focus on how beautiful it was and the leaves changing and the, the leaves slowly falling through the sky. And so if you're stuck in anxious thoughts, focusing on practicing positive thoughts is a helpful tool. Now, that should be balanced with also processing the anxiety when there is something to do with it. Okay, good to know. But if you can just focus on where you want to think about, that is very helpful. All right, cool. Happy place helps learned in EMDR. Yes. So EMDR does a lot of these kind of visualizations and active imagination skills. And this is going to be a little bit like maybe even sound like I'm being shady. Really not. I think EMDR is powerful, and I'm sure I will be certified in EMDR one of these days. I've all the therapists that I love use it. I don't yet, but I think one of the things it does is it just gets you distracted enough that you put your defenses down to some of these skills and then tap into these powerful visualizations. So visualization is very simple, like literally closing your eyes and visualizing something. I don't care if it's a flower, you in a different place. Everyone does have the ability to do it because everyone dreams. It's just taking that skill of dreaming, which is how we process and learn, and using it in a way that is intentional. As you can say, like obviously people will be like, I have the weirdest dreams, which usually they're not as weird as you'd think, or they people say. They're usually make a lot of sense given what the person is going through. But those dreams are your brain trying to process, but it's not as good as when it's unaided by the mind. And so one of the things we try to do in therapy is get your brain and your mind to be friends. So your conscious mind and your subconscious brain, we want to get them to get along. Okay, so what does a typical session with you look like? I mean, that's really hard to say because it varies from client to client. I have some clients that are really aware of how they feel and what they're struggling with. And then I have some clients that are struggling to have that direction. And so if the client needs a more guided approach, I do it. So I tailor every session to that client and what they're going through. My goal is to get that client's goals to be met. So it doesn't really matter what I think would be best or my opinion. I use the skills that I think would work with the client. And if they don't work, I try different skills. So some clients really connect with certain skills, and we just use a lot of those. I've had clients that are really into gaming and Dungeons and Dragons and role playing. So like I will draw in that example, a lot of strategic, what we would say is future authoring, where they're getting to figure out the kind of person they want to be, and we tailor therapy to that. But, you know, we're going to be processing the same stuff just with a different framework. And so that's one of the things that's really fun about therapy, is like being creative and finding a way to tailor it to what people really connect with most powerfully. All right. Also, technically, grounding is great. Yeah, grounding is just being grounded in the present moment. And so that could be like the five senses and thinking through them. And if you add that to visualization, it becomes really powerful. So, in other words, if you're imagining the place that you want to be that's like peaceful, and you're thinking about what it smells like and what it feels like, it makes you way more grounded. It takes more imagination, which will also, like, without you even realizing you're doing it, stop the anxiety. Okay, I still remember the moment you were born. That was my dad, by the way. So that's a good reveal. You weren't running then, and I'm not running tonight. Good run. Okay, I don't really know what that means. I still remember the moment you were born. You weren't running then. That's good. That'd be weird if I was running away from just popped out, running away. And I'm not running tonight. Well, good for you, Dad. Good run. Yeah. Well, I'm happy with the run overall, even though it was definitely a trial. My legs gave out at a certain point, but I gritted my way through the rest of the 10 miles that I'd left that day, and then the 10 miles the next day. So 40 miles total, all Spartan style. So obstacles the whole way. Yeah, so Lana mentioned the name your brain exercise, and this is one of my favorite. It's a really weird one, and I'll just tell you my story with name your brain. So, and some people love name your brain and some people hate it. But name your brain is an acceptance commitment therapy exercise, which we call ACT. And in it, you name your brain. And what this is a diffusion exercise. So it helps you to not be as fused to your thoughts as you might be naturally. And it had another benefit for me. So I've always had self-regard, positive self-regard, as a really difficult thing. I'm really hard on myself, really kind to others, and incongruent in that, or used to be at least. And so I named my brain David. That is a childhood friend, one of my favorite people. He did say, I think, that because I used him in a sermon and I didn't mention his last name, but it's David Leland. He's from Michigan. And David, he's a great guy. The one thing that I will say is his biggest weakness is he's really hard on himself. And so since I'm really hard on myself, I really related to that. And so instead of like talking to myself like I normally did, myself like would to David. And so it's a technique that ended up, for me at least, making it so I naturally started to talk to myself like I was a good friend of mine, which is a great way to reframe your thoughts. And so I started being like, David, like, it's like I'd be like, it was worst day ever. And David's like, then that was what David would say, my brain, right? And I'd be like, oh, come on, David. Like, it's not the worst day. Like, you're gonna be okay, David. I love you, buddy. Come on, give me a hug, right? Which obviously you can't actually give your brain a hug, but metaphorically you can. Gia said, do you have any unpopular opinions or anything that society typically deems as positive that you would say the opposite of? Oh, so many. I have so many unpopular opinions, Gia. Most of my opinions are unpopular. So on the topic of mental health, yes, there's so many things I could rant about that you hear, especially in the pseudo therapy stuff, but I'll give you one that a lot of therapists will talk about as a positive that I think can be in certain circumstances, but like be careful how you say it publicly. And that is affirmations. Affirmations can be good. I've even given those exercises at times, but they need to be grounded in reality. And you need, and the goal is not like if we're thinking on a scale of 1 to 10, 10 being you were the best person on the entire planet, and 1 being you were the worst person on the entire planet, 5 would be probably a healthier place to be. And in some ways, it's that's like a bad framework, because it's like that's not the point of positive self regard. The word self-regard is to look at again, guard, look at. Well, so the guard, look at, and again. Okay, that's regard. So when we say positive self-regard, we're really talking about awareness. We're talking about deep self-understanding, and that includes knowing what you're bad at. And so another one is like, I talk about reframing and how it should be done where we're adjusting slightly, and I'll have some therapists that will react to the opposite. So they're like, oh, you've got a negative thought, turn that to a positive thought. And it's like, yeesh. Also, coping, another thing that a lot of therapists teach, can be good if we're talking about acute panic or struggles, right? Coping should be only used somewhat. And at other times, you want to actually process. And if you're constantly just trying to cope your way out of your anxiety, you might not be dealing with. That's why I even said when the visualization and anxiety, it's like that's part of it. And then you balance that with processing. So everything is rupture and repair. So hopefully I answered your question enough. It's been my saving grace lately. This is Lindsay. In addition to spending time with God, the visualizations, I think she's saying. Yeah, that's great. I think there's quite a bit that society says is positive, but is destructive to your well-being. Yeah, be really careful about anything that you get from like a TikTok in general, like 30-second video. I mean, like I'm a doom scroller. I wish I wasn't. That's fine. I mean, it's not great, but whatever. It's life. We all have, attention spans like goldfish now. It is what it is. But if you could not take your information from that, that would be good. So, like, don't jump to the conclusion. I think Gia actually had me watch or tagged me I watched this reel about bickering amongst your friends or something like that. And like, friends, this woman saying, like, friends that like make fun of other friends are 3 times more loyal according to scientific studies, which is like, that line is a rare one because it sounds good if you don't think about it, but it's actually a contradicting sentence, because that's not how scientific studies work. How do you quantify 3 times better? And how do you quantify who is actually a bickering friend? And like that would have to be um, a self-disclosure study. But then how would you also have a self-discover for how loyal they were? In other words, the best you could get is like friends that pick on them other friends consider themselves more loyal than friends that don't. And that's a deeply flawed study if that was the case. Also, there was no study listed, of course, because it's not a study. It's just bull crap. Okay, I think there's quite a bit. Yeah, so many things we know. LOL. The whole how would you describe yourself without comparing yourself to another person thing. As a good example of an exercise, yeah, so that's a difficult one. I remember I had one client that when she first came to therapy, I asked her to describe herself, and every single thing that she said on the list was about how she related to other people. Like, not just comparing, not just like, oh, I'm short versus what? Other people. I'm smart. Oh, versus what? Other people. So, like, yes, we get a lot of our identity clues based on other people. But she had an extreme version of that where she was completely identifying herself based on basically codependency. And she went to therapy for a long time, and she is herself happier than she's ever been. Like, talks about how like life is realistically positive, but like this is the most happy, exciting season of life. And it comes from really getting to know herself. It comes from the process of being able to define herself without it being just in comparison to other people, which is like what we're trying to do in therapy is somewhat getting you to be able to have the courage to look at yourself and see who you really are. And we can start by looking at other people, but eventually we got to come to the point of really deeply looking at us. And that can be frightening for some people. So, trying the exercise of describing yourself without comparing yourself to another person is just a helpful exercise to see how hard it is, because it's really challenging. Melody says, if someone is picking on someone else or talking bad about someone else to me, means they will talk trash about me to them, not more loyal. Yeah. So one of the things I might have even said this last week is that I wish people would, man, I talked about this somewhere, where I wish people would stop trading personal affirmation for pattern recognition. Ladies, and this is actually just as true for gentlemen, but I will say, ladies, if you want to find a loyal man, focus on a man who treats you so well, but focus on a man who treats his mama right. Focus on a man that shows loyalty in all of his relationships. And this is, of course, true for men and women. And I think, people have heard this one before, but like how someone treats people that can't help them, that aren't going to make their careers, that aren't in my entire life. I'm just here. Hopefully I'm still connected. It says warning it. Okay. I don't want anything from you. I'm just here to help you in any way that I can. It's a privilege to be able to do that. All right. Lana asked about, what about extreme panic attacks? Like you feel in the moment, it's never ending. So that would be the time to do the grounding exercises. That would be the time to do the breathing. That would be the time to, so at any moment, if you can get back in your body and start catching it, you start to calm down. Your body cannot sustain panic unless your mind is helping it. So in other words, what happens is we freak out about the fact that we're freaking out, and that escalates the panic. And usually it's because we're trying to do something that our body isn't listening to about. And so if we can focus on what we can control in that moment and then put all of our attention there. So like, this is a little bit of a tangent example, but like when women give birth, especially naturally, they will focus on some point, or they're trained to focus on some point, and it might be like a point in the room or something like that, and get really good at focusing on that point, and that alone allows them to be grounded enough that they don't become overly anxious and in too much pain. And you can do the same thing with panic attacks. I did say it last. Okay, so Gia, I was gonna say, I thought I said it last week on here. See, Gia's listening. Oh, my mom said I love her so well. Well, that's good. It helps. I do. And I said this last week too. Yeah, my internet is buffering a little bit. Sorry about that, guys. What if their mom is not in the picture? Yeah, I'm really just saying pattern recognition. So pattern recognition is, I'm looking at the patterns of that person's life, not the way they're treating me. So how are they in other relationships? How are they in friendships? How many friendships do they have that they've had for 10, 15, 20 years? Like if somebody, for instance, doesn't have any really long-term friends and has, conflict with everyone, I'm not saying that's a red flag and run for the hills, but it's definitely yellow to orange. There are people that have made huge life changes, and based on those new life changes are building healthier relationships for the first time. That's great. And so they might not have a great history of healthy relationships. But I'll say real growth goes slow. Healthy growth is something that takes a long time. So you might have somebody that like is got a lot of great changes they're making now to their life, but don't expect that those bad patterns from old habits are not going to show up, because some of them will. Can you talk about derealization some? Why it happens, how to handle it, and how to support someone else? Okay, derealization. That's a great question. Derealization. I'm trying to remember the specifics on derealization. Were we text about that fairly? I'm going to have to wait answer on that one just to be sure the details, because it's not a term that I use a lot, but I have. It's just after 40 miles of running, that's a hard one for me to remember. Chatting away. It's one of the things with live chats that I'm like, keep chatting. What was your best advice for getting over a disordered eating or negative thoughts? Um, so with the disordered eating one specifically, I would say that's a visualization exercise that is my favorite um, tool for that. At least if the client is good at doing visualizations, because what I'm betting is the person's relationship with food has been kind of programmed to not be healthy because they've struggled with their self-identity. And so, like, for instance, and of course, there's an interesting relationship with people who overeat and are bulimic or, binging, purging kind of thing, and then anorexic. Either way, there probably is an unhealthy idea of their body. And so, like, for instance, if we have somebody who's struggling with anorexia and they have a bad, or, have a bad relationship to food, starting to visualize themselves at different weights and be at peace with that and have those conversations. Now, that might sound like a weird exercise, but it can be very powerful to unlock and realize, Merry Christmas, Mr. Fat Bedford Falls. I got distracted by that comment. That's the ADHD in me. I'm not really ADHD, but I have moments. Um, yeah. In terms of negative thoughts, I would say practicing positive thoughts. Empathy and empowerment, definitely always good skill sets to use. So, to conquer your negative thoughts, don't focus on conquering your negative thoughts. Okay. Take your negative thoughts and sometimes bring them right there to the surface. And then think about what is helpful about these thoughts, what is hurtful about these thoughts, and then is there a more helpful alternative? You are not ADHD. I am not clinically ADHD, no. Like I said, I think everyone who's raised in my generation and the generations after me has a significantly influenced commercial. Okay, it looks like I'm back. Sorry about that, guys. Um, it looks like my Starlink is not doing great, and I don't know why. So that's a little frustrating, but we're managing as best we can with using this technology. I'm almost positive I parked in a spot that had nothing above me, and that usually makes it great. But anyway, talk amongst yourselves. I'll give you a topic. Miracle Mile is neither a miracle nor a mile. You can discuss that next time. Most of my negative thoughts are predicated on a fear or doubt in an attempt for my ego to undermine my faith. A lot of times, I mean, fear in general is usually about, well, at least it displays in control. And so that's another thing that can be a helpful tool, is letting go of that control. So, do you think ADHD can cause anxiety? Yeah, of course. So, so ADHD, since it's becoming a topic, is not just having an attention deficit. That's part of it. It's also having hyperactivity. Now, there are different forms of ADHD, but the traditional one that most people think about, at least, is hyper. Um, so, in other words, hyper aware of all these things going on, which ironically makes it harder to focus and then makes them sometimes way less aware of what someone is trying to communicate in that time because they're just overstimulated. Whereas there's also a thing called hypo, which is the opposite. And so same with people on the spectrum, with the like autism spectrum, there's hyper and there's hypo. So like some people with autism do really well with like music playing in their ears and will wear headphones like all the time. And other people, that would be the biggest nightmare of their lives. And it just depends on if they're hyper or hypo. Um, all that to say, hyper focused on all of these things and cannot just concentrate on one thing is going to cause anxiety. Yay, I'm back. Yep. I think weight can be a safety zone. Overweight can be a mental protection after one has been hurt or feel unattractive, hence not being hurt again. It's very insightful, Melody. I actually had a friend that literally happened to her. So she lost a whole bunch of weight. All of a sudden, she started to be treated well by guys, and she was so uncomfortable by being treated well that she intentionally put back on the weight. I mean, this is doing, she even said it outright. And I was this person, but I would say there's a good bet trauma in her childhood that is going to explain um it's just like the heart has reason doesn't know. When these things occur that seem irrational in the moment, there is a rational reason. And it's not always trauma. Sometimes there's a lot of little influences that can affect behavior, a lot of cultural influences that can affect behavior. Like, just for instance, like with the weight one, if a bunch of people are just treating you a little nasty and you just kind of like sense it's probably because of the weight, and you're noticing a bunch of skinny people that are being treated really well, and then it just kind of builds up. And even if it's a misunderstanding and you're not actually entirely right, that story becomes more and more powerful. And that story, once you've got a story deeply ingrained, your brain is trying to find evidence to agree with it. It's trying to find evidence to support it. So that's one of the things that we find with weight things, with self-image things, with self-regard, with self-identity stuff altogether, right? So yeah, I mean, it's a sad truth, but like anything you try to change in your brain, in your mind goes like, I want to do this differently. There's going to be a part of your brain that is going to fight back and not want to make the changes. All right, Joe, would you agree that ADHD, ADD, OCD, it's a lot of covering around a lot of ground, can be a gifted person outside of the discipline of discipleship, only characterized as a disorder when the negative effects are only things measured? Okay, so here's a good thing to know about diagnosis, and this is the thing that, okay, going back to Gia's, things that's really frustrating as a counselor who kind of knows their stuff, at least better than some counselors on this one. It's not a disorder if it's not a disorder. And I know that sounds like a self-obvious question, but this is true, okay? So what does that mean? If it's not maladaptive, you don't have the disorder. So this might be controversial to some people, because some people love the identity of like, I have ADHD or I have, autism or whatever. You don't if it's not maladaptive. So in other words, if you're a high functioning person, I'm a high functioning person with ADHD, or like I have ADHD, but it doesn't hinder my life in any way, then you don't have ADHD. It's only a disorder if it causes disorder in your life. And so if you've learned to cope with it to the degree that it's genuinely not. Now, sometimes people don't feel like something is a disorder, but all their friends and family would say it is. So that could happen like with anger management issues, or they could happen with Schizophrenic people, like some schizophrenic are perfectly happy being schizophrenic, but they can't function in society around other people. That's still a disorder. But if you're coping well and everything's going great for you, you don't have any, it might show up in fight or flight. It's another thing that can definitely happen, but you don't actually have that disorder. Okay. I think for me, it's a fear of not being in control. I don't have a lot of control in my life. Yeah. And that's hard when we feel a lack of any control, and journaling and processing can definitely help as we are in difficult circumstances and trying to figure out how to manage it, and then focusing we can control, which is only ultimately us. The reality is the only person you can control is yourself. Joe, in my opinion, it is a super powered car with really loose steering. If you can figure out how to steer it, it's super fast. I think you're talking about ADHD, but either way. Have you seen the post about symptoms of being neurotypical? Yeah, and I really, my personal, this is not the professional thing, okay? I think that there's like neurotypical is the term, and there's neurodivergent. And right now that's only really used with autism, and I think eventually there's going to be more specific diagnosis. Autism, that's my personal opinion. But none of that's a clinical diagnosis. I'll never forget the look on my counselor when I told her the voices I hear are saying nice things about me, so my schizophrenia wasn't disorderly. Like internal family systems therapy is essentially intentionally using schizophrenia to become healthier. And schizophrenia, as it is clinically schizophrenia, is obviously a disorder, right? It is a problem. But a milder form of hearing different so schizophrenia is hearing different voices that are delusional or whatever, but actually intentionally kind of using those different voices in your head to process different thoughts is something that everyone does. The same thing with like, okay, it used to be called multiple personality disorder, but now it's dissociative identity disorder, which I will say accurate label. So I'm glad they changed it. Okay. But everybody has it to a lesser extent. So everybody has different parts of their personality. And if you are responding to trauma to the point where it dissociates, that's when you have dissociative identity disorder. So in some ways, if I'm being more accurate, it's not like everybody has a form of schizophrenia. It's more like everyone has different parts of their personality that show up at different times. It's still them, and they know it's still them. They're not losing consciousness of that other personality type like shows up with DID, dissociative identity disorder. We should be screenshotting all the frozen frames of the give me the different freeze frames for you. Okay. Great. Yeah, that could be an extra added enjoyment of watching this video, of seeing what happens when I I felt like that was a pretty good freeze that I made. My personality types have names. It actually is so it's a therapeutic like this is a genuine evidence-based therapeutic method to name the different parts of your personality, right? It is called internal family systems therapy. When I first heard that, I thought it was a family therapy technique, like of your family that exists outside of you. And then when I looked at it more, it was actually, no, it's internal. So in other words, it's all the different parts. It's like you are a big whole family. And, one of the things that I'll say to some clients is, look, there are simple-minded people. It's just true. But if you're not simple-minded, what is the converse of simple? What's the opposite of simple? Complex. So if you're not simple-minded, guess what you're going to have? A complex mind. And that complex mind, well, is probably going to need therapy. So the higher intelligent you are, and this is evidence-based too, the more you need therapy. So therapy is not actually an example of you're not smart enough or talented enough or together enough, or there's something seriously wrong with you. It probably is that you are complicated enough that having someone else help you put the pieces together is going to really help. I saw the kissy face one. It's one of my freezes kissy faces. Mm. Do you think in some way the psychos logos ways the psycho logos professionals have over conceptualized mental health to some degree? So one of the problems there we see in mental health, we used to use the disease model. And we use the disease model because we wanted to show people that, like, it's not just all in your head, right? Which is actually not biologically true. It is all in your head. But what is in your head is matter, and so it matters. In other words, there's actually neurons there. There's actually, so it's a physical thing, which means we can study it. But looking at this stuff in your brain, right, does not fit the same pattern in many different ways for many different reasons as what's wrong with your shoulder or what's wrong with my left knee right now, which is pretty messed up. You could put it on an MRI and it's going to show you exactly what's going on. And in the brain, the best we can do is like show areas that are lighting up and areas that are not. There's some there. So 80. So autism is the one thing in the DSM-5 that when it's profound autism, which is the official term now, it will show up on a brain scan, which I've got my opinions on that too, that I don't think that should be part of the DSM-5, because a diagnosis should be something that responds to therapy. And that is what, for counselors and psychiatrists or psychologists, it's complex, Joe says. Yeah. Well, good thing God gave us you. Yay, Lana. All right, looks like I'm back. So I will say, if you do private practice, I don't think it becomes a problem. The problem is, well, I mean, even private practice that have to have insurance companies, they have to have a diagnosis to then throw into the insurance companies. And that can get them to over-focus on a diagnosis rather than wellness and just helping you be your best you. I thought that was Sybil. Yeah, so Sybil is the case of what's now called dissociative identity disorder. Although Sybil might have been a fake. So that's an interesting thing. They still debate that to this day, but there's evidence that Sybil might have been a fake the whole time. Gia, if the devil responded to therapy, where is that line? If the definition is response therapy, where is that line? Am I reading that crazy, or are you writing it crazy? Because I feel like there's stuff therapy helps but never make go away. Okay, I don't know what you're saying, but I'm gonna pretend like I do. So I don't. So there. Okay. This is gonna be my personal opinion. If it's a disorder, therapy can help it go away. Okay. In terms of mental health disorder. What does that mean, though? It doesn't mean that you will never have the symptoms of that disorder, but they'll no longer be destructive in your life. At a certain point, you can get to the point where you're healthy enough and you know how to deal with them that they're not hindering your life in any meaningful way. So that looks different, and I can't tell people, that looks different in each case and with each person, and I can't tell people what timeline's going to. My battle with depression was one where there was ebbs and flows and waves and good seasons and bad seasons, and I can't for sure say that I'm never going to have a depressed season again. But I can tell you this. For a long period of my life, I have not had a depressed season, because when the symptoms come, I know how to process and deal with it. And so I don't get stuck in it. So it never becomes actually a depressed season. I have a feeling of sadness, but I'm supposed to. And so some of the things that I think is the reason why people say stuff won't ever fully go away is one, they haven't fully processed it yet. And then the other part is maybe it's not something that's supposed to fully go away. Maybe it's something that's actually really healthy. And if the healthiest version of you actually add to your life. And unstable again. I'm going to make sure that next time I'm in a spot that is like super clear to make sure this doesn't happen. I really thought that I was clear. That's what it is. There's something obstructing my view and I can't change it, especially at this point in the stream. If the definition, what's the difference between a psychologist, mental health counselor, and psychiatrist? Great question. So a psychiatrist more and more now deals drugs. Their primary education is in the dealing of drugs. Okay, so this is psychopharmaceutical drugs. So some psychiatrists actually do therapy, but most actually like to. In fact, I've been contacted by a psychiatrist that's like, I don't like to do therapy. I just like to, give people prescriptions, and I want to find a therapist that will take my clients to actually go through the process of counseling. A psychologist is someone that has a PhD in psychology, and that covers a lot of ground. So there's actually three of the mental health field: psychologists, mental health counselor, and social workers. The reason I went with mental health counseling is because it's the only one that's focused entirely, and this is not disparaging psychologists or social workers, but it's the only one that is actually mental health. Psychologists also have to learn a lot of stuff about the brain, and there are many psychologists could not give therapy, would not get therapy. They're into research, they're into studies, whether it's looking at patterns of behavior. Psychology started as a marketing, well, actually started with abnormal psychology and brain injury, but then it turned into like marketing stuff and trying to see trends and looking at politics. So like I've run into a bunch of psychologists that were like, I would never do therapy. There are clinical psychologists that do therapy, and they do something very similar to mental health counselors. And it just depends on who they are, whether it's wellness based, but counseling is a little bit more focused on wellness, a little less diagnosis. We do diagnosis, but we focus more on optimal health. And social worker will focus on like connecting people to resources and working with the system. So they have to learn all that stuff too. In your professional opinion, does the lack of a relationship with a higher power create an obstruction to mental health treatment and therapy? So I have clients and we're able to sustain those positive changes as long as everything goes fine. But then when we become panicked, when things go bad, when we're dealing with trauma, we need something to lean on. Therapist helps, higher power helps, having a community helps. An act is if work it because you're working, saying AA. And so there we go. All right, so I am now officially streaming, but we dropped enough that I'm losing most of my chats. I'm just going to end today with a little birthday, not like I'm wishing myself a birthday, but a birthday reflection. So one of the new in going through this ultra Spartan trifecta weekend was that there's an urge that I had to kind of prove it to myself that I could do it. And I've been processing that a lot. And even though I was supposed to do it a couple days ago, have a good one.